By 2020, 2021, we were getting desperate phone calls from ministers of science and ministers of health all over the world because they realized that promise of mRNA vaccines was not being realized. The mRNA vaccines were not coming. Why? Because it was a new technology. You couldn't make it in bulk at the as any engineer will tell you, you start with a brand new technology. There's a learning curve before you go from 0 to 12 billion doses. And guess what? All those doses were made available for North American and European countries, and the failed policy was the thinking, well, eventually the crumbs will filter down to the low and middle income countries, and that was a failed policy from day one, and we knew that. And so what we set out was to make a vaccine that would be specifically compatible with low and middle income country vaccine producers, because the world paid for that in a big way, not having vaccines right away for low and middle income countries, not only the humanitarian tragedy, but remember, the Delta variant arose out of an unvaccinated population out of India. The Omicron variants arose out of an unvaccinated population on the African continent. And so it was not only a humanitarian tragedy, had we been able to get better support early on, perhaps we could have prevented that awful Delta and Omicron waves. And so the world paid for vaccine inequality, vaccine inequity, and that's what we're all about, trying to fix that. And I think we provide a proof of concept that you don't have to be a multinational pharma company to do big things. You do have to be in Texas to do big things. You don't have to be a multinational pharma company.